And I'd like to first welcome and congratulate all of the recipients of the 2025 grants competition. Thank you for joining us, and I'd like to give a special shout out to our presenters. We really do appreciate the time you're taking to help support all of the grant recipients, because I know you're the people that make that part happen. Okay, so before we get started, I just wanted to be the first to let you know that the 2026 competition actually officially kicks off with the Cheers to Hope event on November 6th at Ambassador Golf Club. So we encourage all of you to connect with your teams and to be able to bring them to this event, to showcase research, to meet with sponsors. It's a fun evening. It's only 2.5 hours, so it's cheap and cheerful. And although some might say it's not cheap, because $100 of each ticket goes directly to supporting our grants program. So the more people that attend, the more grants that we can support. So we really hope that we're going to see you there. So one of the questions we get asked about a lot is how the decisions are made. So I just wanted to touch on this quickly. It's critical to our grants program that the decision making is transparent. And I'd like to sort of highlight the 4 steps that we go through when making the decisions. So first of all, the applications are submitted and checked for eligibility. So what some of you here might not know is that for all of you awarded this year, you are not eligible for an Igniting Discovery grant next year. So some people don't realize this, and we get applications from people who submitted the previous year. That does not mean you can't be a co-applicant or a collaborator. It just means you cannot be the principal applicant. It then goes to the external peer review panel that's made up of experts from across Canada. They discuss each grant and they come to a consensus on the score. This allows all of our grants to be ranked from top to bottom. Those that score below a 2 out of 5 are then deemed unfundable and removed from potential funding. We then look at sponsor criteria, and this is where some people, when you talk to your colleagues, some people say, well, I got a lower score than you, but I got funding and you didn't. This is a critical piece of what we'd like people to know. We look at those sponsor criteria and we start with the highest ranked grant. We match the highest ranked grant with the sponsor criteria until funds are exhausted. And it's important to note that funding is contingent on sponsor aligning, meaning that if a proposal does not match sponsor criteria, they may not be supported even though they've received a higher score. So a good example of this would be, say we have 2 grants that have the same score, or maybe one slightly higher, and there's only one funder left. So one of the grant focuses on mental health of college students and the other looks at stem cell transplant patients. The funder is the Caitlin Bedard Bone Marrow Association that says in their criteria that it must go to a grant that studies stem cells. So even though both grants scored the same, or potentially the mental health grant scored higher, the one studying stem cells will receive the funding. So we hope that clears up for some people. We know it's a small community and people talk, and they should. They should talk and share the scores that they get and the feedback they get. But we just want you to know that we go from top to bottom, and that sometimes a higher scored grant does not receive funding if we don't have a sponsor for that. So we do hope to continue to grow the sponsors so that there's more opportunities for our researchers each year. And you can see by this that we do continue to grow the program each year. More researchers are submitting grants, more funding is being awarded each year, and we're beginning to see the outcomes of these projects with leveraged external funding being one of the easiest these to track, although we're also seeing other outcomes. And that's why it's important that you share the outcomes of your grants as they come in. We love to share the good news. So today, we'd like to introduce you to some of the key people who can support you as you move your funded projects forward. Our main goal today, if the only thing you leave with after all this information is that you are not alone, that is what we would like you to know. There's processes and there's people that are there to help you. We will send this slide deck along with the recording out to everyone after the session. Also our WeSpark website has a lot of tools and links, and so that's always a good place for you to start. So to get us started, I'd like to invite Sarah Cicelli to introduce herself and touch on initial steps needed to move your project forward. Sarah, are you there? Oh,
I am here. Can you hear me?
yeah, we can hear you.
Here
You
I
scared me,
am.
Sarah.
Okay, so the first thing you're going to, first of all, I will introduce myself. I'm the Health Research Coordinator in the Office of Research and Integrity Services, better known as ORIS. We've undergone a name change, but our acronym remains the same. And I'm fairly new to this role. I've only been in this role for a couple of months, but I spent time in the Vice President of Research and Innovation Services office previously. So the first thing you're going to want to do once you've got a funded project is make sure you have an ERSO filled out. And an ERSO is our electronic resource services on, that's what it stands for, Electronic Research Services Online. But it is basically our database of proposals and grants. You cannot get funding. We cannot open a grant account unless you have your ERSO filled out and it has undergone all the internal approvals that are needed and clearances as well. So you get to it at uwindsor.ca/ERSO. You will see it there. Everybody who has status at the University of Windsor has access to ERSO. So if you're an adjunct, you should have access to ERSO. If for some reason you can't get in, just email urso@uwindsor.ca. So sort of that URL backwards. So urso@uwindsor.ca, and we'll get you some help. There's also on the page itself, if you go to the Research and Innovation website, so that's just uwindsor.ca research, there is a link there if you've got problems to open a ticket. So ERSO is your first step. It's really important that every proposal that you submit, whether it's to WeSpark or any other funding agency, that you start an ERSO file. And we have internal deadlines, which are very important. And our internal deadline policy for our institution is that you have to have your ERSO started and email a proposal to the research coordinator. In this case, it would be me, 10 business days before the external deadline. This ensures that if you need letters from the institution, that you get your approval from your department head and your faculty and from ORIS before that deadline. If you back things up and it's too close, you could put in all kinds of work and we're unable to submit on your behalf. So it's very important that you meet those internal deadlines, which is 10 business days ahead of time. I've mentioned that adjunct professors should have status. If you have difficulty, you just need to set up a password, and you can do that by emailing urso@uwindsor.ca, and they will send you a password. And I think that's it. Karen, is there anything else I need to cover?
Thanks, Sarah. So Sarah, you were also getting, so for the WeSpark grants, there is not an internal deadline. Is that correct?
That's right. That's
And
right. There's
so
no internal deadline
you're
for
preparing
WeSpark.
people for when they take their Igniting Discovery or Idea Grant and they go for something bigger. So we're just
That's
prepping
right.
you for that future state. And the other piece is that for every recipient, except for those who are at St. Clair College, their office manages their accounts. But for everyone else, the majority of the funds, even for our 3 hospital partners, they house their grants at the University of Windsor. So this ERSO is extremely important, but don't let it scare you. We do have people here that will help you. Thanks, Sarah.
Yep,
And
and if you
next
just
up,
want to open, if you just
Yep.
want to open your ERSO and just complete the checklist, if you've got additional documents and stuff that need to be loaded in, you can email them to me and I'd be happy to load them for you.
Wonderful. Thanks, Sarah. And so next up is Rachel Zand, Interim Chair of the University of Windsor's Research Ethics Board.
Good afternoon, everyone. You can hear me okay?
We can.
Okay, perfect. So I'll make 2 disclosures. One is that Harmony Peach, who is the REB manager, would probably be here, but she is graduating with her PhD. So we're very proud of that. And secondly, I am with my soon-to-be daughter-in-law wedding dress shopping. And so if you hear any sounds of exuberation, that's what that is.
That's exciting.
Okay.
And just to show you that research happens all around us. It doesn't matter where you are.
Exactly.
Thanks, Rachel.
So first, so I am the interim REB chair. I will first talk about what most of you most likely already know. I assume many of you already have your TCPS core tutorial. So foundational ethical principles, any research that involves human participants, we need to look at the respect for persons, concern for welfare and justice, and from these three foundational ethical principles, we talk about privacy and confidentiality of data, privacy being the requirement to keep data private, confidentiality is the obligation to protect your participants. Risks and benefits stem from concern for welfare, so that's ensuring that the risks are minimized and the benefits are maximized for the individual participant. Community engagement, so if you're working with your greater communities, make sure that they are partners in the research or are involved in the decision making. And then in terms of justice, looking at data security, future uses, and potential or actual conflicts of interest. The next slide. So in terms of submitting, you're going to want to decide whether Windsor is your REB of record, or if there's going to be another, usually hospital, REB of record, and then there will be the need to submit to U of Windsor for what's called an executive review. So the REB of record is usually determined where the PI is located or the funding is administered, or else whether there is a board of record agreement for your institution. And those are the four institutions, three institutions plus local health clinics and other community groups where there might be a board of record with the University of Windsor, which would make us the primary board of record. So there's two main submission types that you would be interested in, and that is for the initial review. So it's either an executive review, and that is for research that has already been approved by an REB, but you're bringing the research to Windsor as a member of the University of Windsor community, or else you'd be submitting for review, and that would be done by either a delegated reviewer or the full board of the University of Windsor REB. You have to also make sure that that approval is only good for 1 year and needs to be renewed, or else at the very end for there to be a final report submitted. And if any changes happen along the way, you'll have a request to revise or an amendment. If anything happens through the course of research, you would submit an adverse event or an unanticipated issue form. Protocol deviations should be reported as well. So those would be experiences where you haven't followed the approved protocol. It's not expected that that is anything untoward. It may have been by accident or to ensure the safety of a participant. And then request to reopen. We prefer that you don't finalize your study until you're complete, but on the rare occasion where there's the need for more data to be collected, usually because you're the editor of the journal you've submitted your manuscript to says, a few more data points are needed, you may provide a request to reopen. Slide. Just to talk about risk, vulnerability, and proportionate review. So when we talk about risk, and this will determine what pathway for review your ethics protocol will receive. So risk is looked at the magnitude and probability of harm, and vulnerable circumstances are looked at the ways that research may impact the capacity or voluntariness to participate or can exacerbate that participation. University of Windsor, in accordance with the Tri-Council policy statement, looks at proportionate review, whereby we conduct a review in relation to the risk of the study. If it is no greater than minimal risk and there's no exacerbation of a vulnerability, it should go to a delegated review, and that would be done by 1 or 2 reviewers. And then if it's higher risk, it goes to the full board for review. And those meetings, which we have now rescheduled after a bit of transformation of the REB, will be held bi-monthly. Next slide. And finally, here are resources, Tri-Council policy statement. If you're going to be doing anything that involves US colleagues, you should know what the US rules are. There is the website for the University of Windsor REB that has all of the forms and all the information. And finally, there's our contact email.
Thanks, Rachel. Can I
Thank you.
ask you, I think the question for a lot of researchers who are starting out is, what's the time frame that they can expect from when they submit their REB to when they get clearance?
So usually we look at 4 to 6 weeks for that initial response. And, you know, upon submitting, if you need to, revisions, then it will take another, say, 1 to 2 weeks. So we're looking at probably an 8-week time frame. So please be cognizant of that, so that you can get your protocols in on time.
That's right. We often see that people at the beginning of their projects, that's a bit of a panic point. But we can address that later as well about how friendly the WeSpark grants program is. So thanks so much, Rachel, especially coming at us from a wedding dress store. That's a first, I think. That's a first, I think.
Sure.
Next is the person who holds the key to accessing the funds. So we sure keep Dylan on his toes at WeSpark with all our requests. Dylan, are you ready?
I am, yeah. Yeah. So hello, everyone. My name is Dylan Margerson. I'll talk to you a little bit about finance and research finance specifically. So I know that's a little bit scary for everybody, but it's not all that bad. I guess to kind of start with the process, my work starts from the time that we receive your URSO record through what's called a request to open a grant, or an RTOG. And I'll show you what that looks like in what we receive in the next slide. But that basically kind of outlines for us what the grant looks like, or how the setup will be, the basics of the grant. So we basically take that information from Sarah in the ORIS office, and we upload that on system. So we create the grant on our finance system that'll allow you to spend the funds, that'll allow you to create a budget. Spend those funds. The one thing I will note is that we are a lot of the times looked at as the bad guy, because we have a lot of rules and policies that we need to make sure are upheld on our end. Obviously, REB or any clearances are one of them, and that's a hard stop. So if there's a hold for spend on funds, whether it be for any type of clearance, that's something that we don't really have much control over. So those need to be resolved at the REB side, or at the appropriate clearance size before we can proceed. I don't know if there's a full hold on Igniting Discovery, but if there is, that's something that will need to be released before we can release funds. And then on our end, we submit the funding entry, and then the project starts. So once we've done our work, we will send you an email letting you know that the grant is ready to be used and ready to be spent, with some numbers that we'll explain in a few slides, and you'll be able to start spending money from the grant.
And I can jump in there for you, Dylan, and say Dylan's super great to work with. And the key for people who've just got a grant for the first time, I mean, one of the places if you submit to a large funding opportunity is if you make a mistake on where you spent your funds or spend it on ineligible expenses, this is where it can catch you up. And so the fact that we have access to an office that has the expertise and make sure we follow those rules is a really important piece.
Yeah, and as Karen mentioned, there's obviously policies on the funding side of it, and we have to basically make sure those are met. And then on the U-Windsor side too, there's a lot of policies on the U-Windsor side about how money can be spent, what it can be spent on, what needs to be met for it to be spent. So we need to make sure that those are all in line before we approve some expenditures. Not all, some are pretty basic, but yeah. So this is what the request to open a grant looks like. It's not really all that important, but it will contain all the information that we need on our end to set up the grant. So the start and end dates, that'll be your eligible spending period. if there's anything else. So if there's a hold on the account for whether it be REB or any type of clearance, that will show up in the bottom section there, the second orange box. And that will basically tell us that we either need to hold the funds or that they can be released to spend. Yeah, other than that, you will be copied on this email generally. You'll be on the email when we get sent this, so you will see when we get that information. It does take a little bit of time to set up, but we're usually the WeSpark grants, we can move pretty quickly on them. And then this is the bottom section where all of your account numbers and the actual amounts will be. Yeah, I think that's pretty much all for this slide. The clearance requirements. So this is where we will pull the clearances from. And that's just important to note that if you do see that there is a hold on the account, that the funds will not be available until whatever clearance requirements or certifications have been met. So if there's something outstanding, it will tell us that there's a hold on the account, and and then we'll hold them. So this is going to be your uWindsor account number, and this is just basically the basics of how uWindsor labels your account. So obviously your bank account has a number. This will be like your bank account number for uWindsor. The fund is 08. That's a research account that tells us that this is an account supporting research. The department will be dependent on what your assigned or home department is. So if you're working out of the chemistry or biochemistry department, you'll have a 1615 department code here. I believe WeSparks is 2660, and then from there it can depend on your home department code, and those are set. So those if you have other grants and you're in the Faculty of Nursing, it'll be set on whatever that department code is. That won't change. The program, if it's a research account, it'll always be zeros, so 5 zeros. That won't change. And then the project will be your unique project number for your research account. So that'll be the main account that you want. That'll be the main number that you want to remember. So if it's, yeah, so it'll be 6 digits starting with an 8. And that'll be the one number you kind of want to remember, because that'll identify your unique project number, your unique project account number for these grant accounts. And once I do set up the account through the RTOG on system, I will send you all that information, so you'll have an email record of what your account number is. So as far as spending money, there's really 2 ways that you can spend money from uWindsor, from your grant account. One of those is through a purchase requisition, so a payment request, sometimes it's also called. And that's going to be when anytime you're paying someone else other than yourself or another uWindsor employee, it'll be through a purchase requisition. So if you have an invoice that needs to be paid, it'll be through a purchase requisition. If you want to submit a student scholarship, it'll be through a purchase requisition. The one thing I won't get too deep into these. There is a full help article here that will guide you through it. The one thing I will say is if you do have access to a departmental support or departmental assistant, I might recommend using them for purchase requisitions, because they can be a little bit tricky, especially at first. There's a lot of little things with them that can be not so straightforward or a little bit confusing. But anybody that's worked in a departmental support role should have that type of knowledge, and they do require a special license on system. So if you do get set up on the finance system, you might not automatically have access to it. It might be something that you do need to request. But again, I can help you with that. Karen might even be able to at least either direct you to me, or if she knows who to go to for that. But it's just a ticket. A lot of access stuff will be dealt with through tickets. So if you can't access the uWindsor system, it'll be a ticket link that I sent you. You might get tired of tickets, but that's the way that uWindsor does things at this point. So
Dylan, I can add in there that WeSpark worked with Dr. Carolyn Ham over the summer, and we tried to work through some of the frustrations that a person not at the University of Windsor, runs into when they're trying to submit these things. And it's been good for us because when you have to submit 20 in a row, you remember how to do it. For most of you who've just received grants, many of you, this might be your first one. And so you've never done this before. So WeSpark now has people who you'll meet throughout. Maddie's one of them who's going to be coming up shortly. And we can help you do this, not by submitting tickets, but by actually submitting them on your behalf. So don't let this be daunting. We've created a new system. So even the past things you've heard that were horror stories, please have a fresh perspective because we're trying to tackle this in a better way.
And the only thing I will finally say about purchase requisitions or payment requests is they're not the quickest. They're not the quickest moving requests. They go through a lot of different stages of approvals. There's a lot of different steps to get them fully submitted and approved. So keep in mind that when you do submit those payments, whether it be for an invoice or to pay someone, it might take a little bit of time. It might take a few weeks to get that payment to them. But once it's in process, it'll move through those stages and it will get processed, especially if you have good support, which you do. The second type of payment is through an expense report, and that's for either yourself if you incur expenses related to the project, related to the research that you want to be reimbursed for, or if you have an employee that's working for you that's been hired, they will be able to submit expenses as well through the system. So those are expenses that are being reimbursed to you, either a UWindsor professor or a UWindsor employee. And that's basically how you would get reimbursed for those. There is, again, these do take a bit of work to get set up on system well. You might get frustrated with me because I might ask you for little things like boarding passes if you're traveling or different types of receipts. But it is again, it goes back to that we have policies, especially in this case, UWindsor policies related to expense reports and reimbursements and paying UWindsor colleagues. So, but yeah, so there are help articles for those as well. If you are getting reimbursement on system, you will have to set up your banking information, but there's a help article on these slides for that as well. So some final questions. Account balances. Once you get set up with a grant account on system, you will get statements for any account that's active and any account that's current. You will get statements on the 15th of each month. They will be automated. If you don't get them, let me know. I can pull them at any time for you. And then I can also, if you have a lot of research assistant contracts, I can kind of do some calculations to see what your free balance is too, because your free balance, your available balance may not always be the clearest. At this point in time, we're hoping to update that in the future, but based on your current account balance and what's signed off and committed in the future, we can get you a pretty accurate future or current available balance based on that. And then we do have, so I'm the research grant accountant for a lot of health related accounts. So WeSpark, any type of chemistry, a lot of the sciences. But I'm not the only one. So there's three other people that work with me as research grant accountants. So myself, there's a gentleman named Paul. He does engineering, I believe nursing, and then Demi, who is social sciences and maybe a little bit of nursing as well. But there's other people that do the same thing that I do. So depending on where your home department is, will determine who you will be assigned. But either of us can provide that same support. And again, email me at any time, and I'm always happy to help. So my email is dmarg@uwindsor.ca, and then we have a general email inbox, which is resfinance@uwindsor.ca, and emailing either of those can get you in touch with our team. And we're always happy to help. We know finance is not the most straightforward part. So
I know they will be in touch. So I did give Dylan a little bit more leeway on time because research finance and accessing those funds is probably one of the critical things that you're going to be doing with your grant, and that is often the one that feels the most out of control. So I figured you all needed to see his face and know who he is. So thanks so much, Dylan. The next three presenters represent WeSpark's hospital partners research offices. So first up is Jacob Wiebe from Erie Shores Healthcare.
Hi everyone, I'm Jacob Weeb from Erie Shores Healthcare. I'm the research assistant here. So our team is comprised of three people, Nilu, Manira, and myself. Small, but we try to do a lot. Next slide. So our goal at Erie Shores is to advance the academic and research mission of Erie Shores Healthcare, and as part of the broader initiative to enhance health research capacity in the Essex County through our partnerships with WeSpark, and we are working to build research infrastructure at Erie Shores Healthcare and facilitate and promote research. Next slide. So how can we help you? This is a small part of what we can do. We can help you with literature reviews, protocol writing, creating informed consent forms. A big part is also applying for the REBs that go to the University of Windsor. We can conduct trials. Munira is a certified CRC, so we can help you with some of that, and also with writing and editing manuscripts, and help you with writing grants that will go to different organizations. Next. So if you have any other questions for me, you can always contact us at research@eshc.org or my personal email at jacob.weeb@eshc.org if you have any questions or would like to collaborate on a new project.
Thanks, Jacob. And you can also find Jacob many times at WeSpark After Dark because he is a great participant there. And I'll share more about that at the end. Thanks, Jacob. Now from Hotel Dieu Grace Healthcare is Leslie Ward.
Hi everyone, I'm Leslie. I'm a research associate here at Hotel Dieu. So we'll kind of get into a little bit of what we do. I bet you it'll be a little bit similar to what Jacob just talked about. So who we are and what we do, our research and evaluation department acts more as a supports and services department. And we essentially have two main goals. So the first one is offer investigators supports and services to assist in conducting research projects from start to finish. So anything that anyone would need to complete the research project, we're here to help. And then the second is to ensure that the research we engage in is then translated back to our clinical teams to support improved quality of care and overall patient experience. It's very important to us that our staff and our clinical teams are involved in research and they get to be part of our research teams. So that's trying to just embed it into our culture. And that's essentially our overall arching goals. You can go to the next slide here. The one thing that I did just want to talk about quickly, Rachel kind of alluded to it a little bit earlier, but our REB is housed within the University of Windsor REB. So we can't just kind of start a project internally. We have to kind of discuss those projects, the risks associated, and then from there we'll kind of either if it's high or low risk, we'll determine who within our organization that we need to talk to for approval, and then from there we'll go on to REB. Typically, we have to do that through a letter of no objection. So if you are interested in a Hotel Dieu Grace healthcare project, come talk to us first before you fill out any REB forms, and we can kind of help facilitate that. Next slide. This is just everything that we can help out with, pretty much the exact same that Jacob just talked about. Just start to finish projects, developing the ideas all the way to knowledge translation is what we're trying to facilitate here at Hotel Dieu. And then our last slide is just our team. There's 5 of us here. Our main core outside of senior leadership would be Dr. Jen Voth, myself, and then Bailey Chabai. So if you have any questions or see us around, feel free to talk with us. And then the next slide is just our general email. If you do have any questions, you can just message research@hdgh.org and hopefully connect with some of you on future projects.
Thanks so much, Leslie. And next up is Erica Figgins, and she is from Windsor Regional Hospital. Erica, you there?
Yep, I'm here. Hi, everyone. I'm Erica. I am the coordinator in the Corporate Office of Research at Windsor Regional Hospital. So just going to give you an overview of what we do here. So the Corporate Office of Research is a centralized resource for researchers here at the hospital and in the community. So like our other partners, we're here to support folks throughout the entire research process. So we do have an intake review process internally for all new projects being submitted and using resources here at the hospital. We're here to support people with their REB applications. We can offer tools to support project setup and running, and then we can help with funding, contract reviews, and then for clinical trials, we can also offer supports through our research associates here in the office. So next slide. So this is the general overview of the approval process for new projects coming through the hospital. So all projects coming through need to be reviewed at the Office of Research. And you can initiate your intake review by submitting a copy of the protocol, a draft of the REB form to our general research inbox. So research.office@wrh.1.ca. So our office does the intake review of those materials. We review to ensure that what the project is asking for is feasible at the hospital, and we also obtain departmental approvals. So with that is our departmental impact review process. So all new projects need to undergo a departmental impact review, regardless of the resources that are required. So that review involves getting signatures from the department directors, VPs, and physician leadership where applicable. And our office facilitates getting those signatures. So once the intake review is completed and all the departmental impacts have been signed, our office will then provide a no objection letter to include in the submission package for REB. Just a note that if you submit your project to REB before submitting it to the Office of Research, our REB administrator, Aswani, will punt it back to us so we can make sure that the intake review is completed. So all of the information about our Windsor Regional Hospital REB can be found on our Windsor Regional Hospital website, and we have a comprehensive submission guide for folks to follow so they know what exactly is required. So this was mentioned before regarding where to submit for REB. So if the principal investigator of a project is from Windsor Regional Hospital and they are anticipating to use data, recruit participants, including patients, staff, students, etc., or use any resources from the hospital, Windsor Regional Hospital REB should be the primary REB of review. If not, if the board of record is, say, University of Windsor, but there's still resources being asked from Windsor Regional, that REB submission will still have to make its way to Windsor Regional as well. And depending on the timing during the month of when that happens, we can request an expedited review from our local REB. And if Windsor Regional Hospital REB is not the primary REB, they still ask that investigators send all the annual renewals, amendments, safety reports, etc., to them for awareness. Next slide.
What's up, brother?
So this is our executive
come in.
leadership team. We have Dr. Saad, Jonathan Foster, and Dr. Carolyn Ham, who is our research champion here at the hospital. And this is our internal research team. So our director is Gina Bulkey. Manager is Grace Park, who will be returning from mat leave later in November. Myself and my colleague Batul Kamushi, who is our Accelerating Clinical Trials Coordinator. So if you have any questions, feel free to reach out by email or give us a call. All of the information about our intake review process and REB can be found on the website. We also have a research and academics page that lists all of our active researchers at the hospital and activities that are going on a monthly basis.
Thanks so much, Erica. And I think the key takeaway from the hospital research offices is it really helps to do planning in advance and connect with all of you in advance so that we can make sure that the proper protocols and processes are followed. We do have great collaborations with the hospital partners across the partnership, but I think that's a key step, is you save yourself a lot of agony if you reach out in advance. So next up is Eric G, who's been helping WeSpark develop some templates and streamlining some processes that will better support our grant recipients. And this goes along with the pilot testing we did with Dr. Carolyn Ham and kind of getting in the weeds with a clinician to see what are really those struggles that come up. And so Eric has been helping us create some of those, and he's just going to touch on some highlights here.
Perfect. Thanks, Karen. Hello, everybody. My name is Eric G. And so I've kind of been brought on to kind of help with some process enhancement and additional resources to help the whole grant process. I know it can be quite challenging from start to finish, seeing it all the way through. So we want to help streamline those processes, make them as seamless as possible, and provide those additional resources. So the focus points I have on here are just for like first-time grant recipients. We would love to get like some feedback from you on what resources you think would be beneficial to help manage your grants, whether that's templates, additional resources, reference points, anything that we can do to kind of make that easier. And then what information do you need for kind of like your administrative decisions? Any kind of information, that way we can kind of create like customized resources for each of the researchers to see what kind of fits your project and stuff the best. And for any returning grant recipients, if you found any processes that were extremely difficult, very time consuming, we'd like to kind of help alleviate those pain points and make them as simple as possible, or even whether that's just spreading more awareness on certain information to make things a little bit easier. Or if you did run into problems, how were they kind of like resolved, and ways that we can continue to use those processes and let other people know about them. So we do have a bunch of current resources that are just kind of open to everybody to kind of use as they need. And it's just research assistantship and appointments. A lot of people have wages, payroll, so a form that kind of details out everything that you need to know, and all the different inputs for the forms, requisition distributions, whether that's based on like percentages, grant amounts, the amounts that should be entered into the system in order to reflect what will be processed back to the grant. And then just a grant management tracking system. So using the resources that Research Finance will provide for you, and then essentially putting them into a template that kind of spits out information that makes it a little bit easier to understand. But those are some of the resources and stuff that we have, but I would love to hear feedback from anybody as to additional resources they would like to see and how we can kind of enhance or make the process better.
Thanks so much, Eric. And we will share some of these templates that have been created with you. You may not need them right away, but you might start to see where they could come in handy. And so we'll be sharing those with you. Thanks, Eric. And next up is our newest research associate. She's just going on 6 weeks. Madeline, are you there?
Hi, thanks, Karen. Hi, my name is Madeline Garlotti, and I'm the new Clinical Health Research Associate at WeSpark. I'm here to assist with project coordination by helping streamline communication and processes involving students on your research project. So my job is to help bridge the gap between students and their supervisors in order to assist with clear and efficient communication, which will ensure that the research expectations are being met. I'm also here to guide you and your team through local research systems, certification requirements, and administrative hurdles between our community partners. Next slide, please. So if your research involves students, I'm here to ensure that they meet all required certifications and training, support them in navigating research systems like the REB protocols, and also connect them directly to relevant WeSpark resources. By supporting your students in these areas, I will help you avoid delays by coordinating student hiring and streamlining communication to ensure a smooth and efficient onboarding process. In addition to this, I help promote research opportunities and connect students interested in clinical research with relevant projects and mentors. So I work closely with the Schulich School of Medicine to engage medical students who are interested in research opportunities. And I'm also connected with students and programs at the University of Windsor, including the Masters of Translational Health Science program. So if you feel like you need additional support and that would be beneficial to your research, I can help connect you to these students. Additionally, I collaborate with our community partners at Windsor Regional Hospital, Hotel Dieu Grace, and Erie Shores to build support and momentum for your research initiatives. So if you think I can be of assistance to you, or you would like to know more about how I can help you, please don't hesitate to reach out.
Thanks, Maddie. And that's just been in 5.5 weeks. So we can't wait to see what else you're doing as you keep going. So now that you've learned about getting your projects launched and underway and getting some funding going, you'll notice that August will come very quickly, August 2026, and that's when your grant will be over. However, you recognize you're a bit behind, you need some more time, and we just want you to know that the WeSpark grants are a very friendly program. For many of you, this is your first grant, so we want you to be successful. That's the main goal. So extensions are granted. There's often unforeseen circumstances, delays, potentially even with REB. Maybe it's your first time putting one in. And for some of you, many of you, the projects are actually overly ambitious from the beginning. So we want you to be successful. So just simply submit a request to WeSpark for an extension, and we'll select dates that help work to support your project. You are also expected to submit a final report. This can take any form and can be added to your project website under the impact section. If you have an infographic, if you have something that was community facing that shared about your research project, that would be fine to use as a report. We're not looking to make this a make work project. So anything that comes out of your project would be could serve as your report, letting us know the impact of your project. And when you accepted the funds, you all agreed to acknowledge WeSpark and the funder. So included in this is an acknowledgement of your affiliation as a WeSpark member. So you are receiving a grant because you are a WeSpark member. And so I know that many of you have multiple affiliations, and we hope that you're including your WeSpark membership in your presentations, publications, and email signatures. So you'll see here 2 examples of people who have included WeSpark as one of their affiliations. Many people have 3 or 4 affiliations, but they still add WeSpark membership as one of them. And we have a whole set of new tools on our website that came from our members asking us for a spot for them. So it's under the Our Researchers section on our website, and it has our branding, it has access to our logos, it also has some templated language for you to use in your email signatures. And so this is available on our website. Please check it out. It's a great spot to start and has easy access tools. So coming to the end of our session, we'd like to highlight a few tools and resources that are available to support your project. So I'm going to invite Mo to provide a brief overview of REDCap.
Thank you, Karen. Good morning, everyone, or good afternoon. My name is Mohammed Farjal. I am the research associate here at WeSpark. I also serve as the institutional REDCap coordinator here for the University of Windsor and WeSpark. First and foremost, a huge congratulations on receiving your Link Discovery Grant. My goal today is to introduce you to a powerful tool that has enveloped your project's REDCap. So what is REDCap? The name stands for Research Electronic Data Capture. It is a secure, PIPEDA-compliant web application designed specifically for you, the researcher. It allows you to build databases and surveys to collect, store, and analyze your project data all in one centralized place anywhere in the world. Next slide, please. REDCap isn't just a tool, it's the gold standard around the world. The REDCap consortium includes over 8,000 institutional partners of hospitals, clinics, universities, so on and so forth, in 164 countries. The software has been used for over 2.5 million projects used over in 2.5 million projects since 2004, and it's used by 3.9 million users worldwide. And it's been cited in nearly 50,000 journal articles, and that numbers has been undersold to date. Next slide, please. And its impact right here in our local research community has been significant and has been growing continually. Just from the past year, we have seen a 22% increase from 2024. We're up to 523 REDCap users. We also see our researchers managing 360 projects, which is a 37% jump from last year. And lastly, we've seen a 71% increase in the survey responses of research activity being conducted here with ReSpark, within the ReSpark community. Crucially, REDCap is supporting major research endeavors where we have over 40 funded projects utilizing REDCap, which utilizes $10.2 million of leverage funding that we since its start in 2021. Next slide, please. Many past and present Ignite Discovery projects have been successfully utilized REDCap. And you can see some of the examples here from the expansion of the clinical trials program at University of Windsor by Dr. Caroline Ham, to the evaluation of the oral health program for mental health applications, as well as the study of culturally safe nutrition plans by Erie Shores Healthcare. It's truly a versatile tool that can be adapted to a huge range of health research projects. Next slide, please. As you embark on your own future projects, please know that we have my full support. REDCap is a fantastic resource and a tool to utilize in your journey with your projects, and we're here to help you make the most of it. If you have any questions or assistance in setting up a project, please don't hesitate to reach out. You can email us at the general support email at redcap@uwindsor.ca, or you can contact me directly at mohammed@uwindsor.ca. Thank you, and once again, congratulations, and I look forward to seeing how your projects ignite discovery.
Thanks so much, Mo. And also, Mo is available to do training for your team. So if it's something you'd like to use, but you're not sure how to go about it, he's great at teaching teams to use it. Thanks so much, Mo. So up next is the University of Windsor's Luddy Library, who has many resources to support researchers. So Pascal's going to share some of these with us.
Hi, folks. My name is Pascal Calarco. I'm a scholarly communications and systems librarian. The Luddy Library specifically can offer help around data, including research data management, publishing your works, and depositing works in the institutional repository and more, and I'll be going over those services here. We have a dedicated unit that supports research and publishing services. We have 7 librarians who have more than 120 years collectively of professional experience, with 4 senior librarians and 3 newer librarians to help you across a range of your needs as researcher. Next slide. Data is an important area. So everything from help with discovering data sets, research data management, finding appropriate storage for your project, analysis, meta-analysis, evidence synthesis. We can all help with those things. And there's some links here for you. The main thing with anything data is just email libdata@uwindsor.ca. Next slide. Luddy Library has done a lot of work to negotiate APC waivers with major publishers. To date, since 2021, we've saved the university $656,000 in APC waivers, and that doesn't even include this year's numbers. Next slide. You can find journals that offer APC waivers or discounts through this journal finder that's on our website. It's through Power BI, and we keep this up to date as we add new publishers to this. Next slide. So just here's an overview of some of the publishers that we have complete waivers for or discounts. Next slide. Publishing is anything from starting up new open access journals to helping you find the appropriate journal at the lowest cost to publish your research. You have lots of options these days. Many of the hybrid journals that are on the Journal Finder, I think it's over 5,000 journals now. So very happy to help you with any of these things. Also with research impact, looking at how to measure the impact of the work that you're doing. And we have an email address for these services, scholarship@uwindsor.ca. Next slide.
Thanks, Pascal. I think we could have a whole hour just on the services at the Luddy Library. So thanks for getting us started with that. Next up, we have Jill, WeSpark's Translational Research Associate, to round out and finalize our workshop.
Hi, everyone. I'm Jill. As Karen said, I'm the Translational Research Associate for WeSpark, and I'm just going to be going over how to maximize your resources that WeSpark has. So as a funded researcher, one of the first steps you should take is to create or update your profile on the WeSpark website. And it has several key benefits. So first, it increases visibility. Your profile isn't just seen by the WeSpark members, but also by other researchers, potential collaborators, and funders beyond our local community. Secondly, you can showcase your expertise. So you have the ability to add publications, highlight your research areas, and link your projects. And lastly, having a profile facilitates professional networking. It's about who you know and who you can connect with. And an engaging profile increases interest from peers, leading to new collaborations and new opportunities. And the best part is that you have full control to update your WeSpark profile through the researcher portal, which I'll discuss later. And just so you know, all awarded investigators from 2025 competition already have a profile created for them. So check them out. And if you have any information that needs to be changed, you can let me know and I can change that, or you can request a researcher portal account and change it yourself. So this is just an example of one of the profiles on our website, Dr. Ming Pan, and you can see basic information like his name, job title, affiliation, and contact information. And it just quickly tells other people who you are. Next slide. And next, this is the section that highlights Dr. Pan's linked projects and programs. So the programs you can see on the top. And this feature makes it easy to see what he's currently working on and the areas where he's actively involved. Next slide. And then this is the other tab for publications section showing the research outputs. So listing these here helps build credibility and allows others to see your contributions in the field, no matter how many publications you have. You can also display your projects on our website, and it offers additional key benefits that can significantly boost your research impact. So first, enhance exposure. Projects displayed on our site get more visibility from the research community, the general public, and potential industry partners. It also attracts more funding and collaboration. So by actively promoting your projects, you increase the chances of drawing in additional funding and new partnerships. And lastly, sharing your projects contributes to our broader mission of knowledge sharing. So by using the WeSpark platform, you're helping advance translational research and encouraging others to build on your work. And additionally, you can highlight project outcomes under the Impacts tab, showcasing the real-world effects of your research. This slide showcases one of the projects on the WeSpark website. So you can see the project title, principal investigator's name and affiliation, along with the funder logo and grant duration. It just provides a clear snapshot of the essential details of the project. And then further down the page, you can highlight related programs, nucleus cores, and the project overview. This slide also lists co-investigators and collaborators and features an impact tab where you can display the outcomes and significance of your research. So now we have the researcher portal, which is a customized mobile and web app tailored to support collaborative research projects in Windsor, Essex. One of the key features of this platform is its ability to create a seamless connection for clinicians and researchers across our 5 partnering institutions, enabling you to share ideas and spark collaboration effectively. The portal also provides quick access to essential tools, resources, and events, making your research journey more efficient. Additionally, like I said before, you can easily manage your member profile. You can edit and update your information through your login via the researcher portal, ensuring your profile reflects your current work and expertise. So now to go over the research training opportunities that are available to our members. WeSpark has partnered with City Programs, the Collaborative Institutional Training Initiative, which is a highly esteemed provider of professional development and research training. Through this collaboration, WeSpark can offer city training to its members and their research teams affiliated with our partnering institutions. City training not only enhances your research skills, but also ensures compliance with ethical standards required by ethics and funding agencies. Through the WeSpark and City Programs partnership, there are 7 courses available for you and your research teams to take. The most completed courses include Good Clinical Practice and the Biomedical Research Ethics tutorial. A summary of what each course includes can be found on our website, as well as instructions on how to register for an account. WeSpark has also partnered with CanTrain, the Canadian Consortium of Clinical Training Platform, which is a national training platform designed to build capacity and strengthen expertise in clinical and translational research across Canada. Through this partnership, WeSpark can also offer CanTrain access to its members and their research teams affiliated with our partnering institutions. CanTrain was created from a national wake-up call during the COVID-19 pandemic and is known as Canada's most expansive and innovative response to the urgent need for a stronger, more coordinated clinical system. CanTrain bridges traditional silos, working across academia, public health, nonprofits, and the private sector to ensure clinical trials are more efficient. Through this partnership, there are 2 course types available for you and your research teams to explore. CanTrain offers 3 core courses to support research teams in meeting the regulatory standards for conducting clinical trials in Canada. And CanTrain also offers 11 entry-level courses that provide essential knowledge for anyone involved in clinical trials with human participants. The courses cover key topics that everyone from students to clinical research professionals should understand, no matter their role. And a summary of all the courses offered can also be found on our website, again, as well as the instructions on how to register for an account. And if you have any questions regarding any of these WeSpark resources, you can contact me via my email shown here on the screen. And if you currently don't have a research profile, or any of your team members, you can send me your CV or their CV, a headshot, and a brief bio, and I can set that profile up for you or your team member.
Thanks so much, Jill. And having those profiles on the website are a great spot to house all your projects. And it's a good place to be able to quickly link people that you want to tell about your project. So thanks for doing that, Jill. So to wrap things up here, if you've not received an email about our upcoming events, please let us know, because it means you are not on our mailing list. Cheers to Hope tickets are on sale now. Please join us. We'd love to see you all. Next Friday is our think tank with 3 terrific speakers. We have one from United Way, one from Autism Services, and one from the Windsor Regional Cancer Program. And get your abstracts ready and take advantage of the early bird registration prices for our March Health Research Conference. And please stay connected through social media and also in person the first Thursday of every month, except in November when we have Cheers to Hope. We have WeSpark After Dark. It's a no-agenda networking event for our health research community. And for all of you recipients, it's a great time to bring out your teams and make sure you keep connected face-to-face. And so thank you for joining us, and thank you to all our presenters. Congratulations again to the recipients. We appreciate the time it takes to move these ideas forward. Our community really is lucky to have you thinking about their health and well-being, and for submitting the grants in the first place. We know that this is an onerous thing to do, but we're thrilled that you did it. So please be sure to share your progress and your successes. We'd like to shout them out and share them with everyone. I know we went a couple minutes over, but I think we stayed pretty true to time. And if you have any questions, please feel free to put them in the chat or to email us, and we can circulate those after the session. Thanks, everyone.